Good morning, good afternoon, good evening, whatever time you are listening to this webinar. My name is Diana Schroeder. I'm the lead pharmacist for the HCI and AMR division at Public Health England, and I'm also the national lead for World Antibiotic Awareness Week, European Antibiotic Awareness Day, and Antibiotic Guardian. I'm sharing with this webinar with you, which is about the Antibiotic Guardian Schools Ambassadors, which is a pilot for this year. Thank you very much for being one of the pharmacy professionals who has signed up to be a schools ambassador. We're really, really excited to have you on board. So you would have received this invite, which shared with you the call to action, seeking for Antibiotic Guardian Schools Ambassadors. And this project is it's PHE led, but very much working in collaboration with the Royal Pharmaceutical Society and also Boots, who are promoting it to their pharmacy teams and pharmacy professionals. So thank you to the two organisations who have been promoting that. Also, colleagues in Scotland and Northern Ireland and Wales are also promoting this pilot. As I've said, it is a pilot for now, so it has gone out to a very select few individuals in the first instance for us to test out this model and for us to get good feedback and see what we need to change to be able to take this forward. We highlighted as an antibiotic guardian ambassador, schools ambassador, you can support in one or more of the following options. And there are three options, and every option is valid. You may choose to do one, you may choose to do two, or you may choose to do three. The the simplest, I guess, of the three is that you could encourage local schools to include a newsletter item on antibiotic resistance during World Antibiotic Awareness Week. And we provide a template for you to be able to do that. You could deliver a short activity or whole educational session to children in your local community. This can be a religious community, this could be a scouting group or a uniform group or even an adult community group. It really is, this is about young children though, so it's about children and youths, but anywhere where there is a gathering, you are welcome to share the activities with them. Or you could deliver it as an education session to one class or during an assembly at a local primary or secondary school. We already know that antibiotic resistance is one of the key issues that we have within the community and hospital settings in Europe and in the UK. So it's really important that we begin to tackle this, and actually antibiotic prescription rates are highest in children. We shared with you 3 steps, which is for you to express your interest by you being able to listen to this webinar. And if you've gotten this webinar directly through an email from us, you have expressed an interest. If somebody has shared this webinar with you, please do ask them to share with you the expression of interest so that we can continue to keep you up to date, and so that when there are resources for us to send out as part of your activities, we can do that. And I'm hoping that by now you've contacted a local school and secured a date, ideally during World Antibiotic Awareness Week, but any time in November is absolutely valid. But we want to we were wanting to start our feedback and evaluation in December. So really will be great if as many of the activities as possible are done during World Antibiotic Awareness Week or other dates within November. And if you are planning to deliver a session, it's important to have a look at the resources, and you are already listening to this webinar, which will take you through a lot of them. So I'm now going to go into the toolkit and resources that are available. Hopefully you already have the email, and you definitely will have the email template that you could have sent out to schools. There is also a newsletter template, which is in the toolkit folder, which the link will be available to you. But within that, you can send the draft newsletter template to the schools. But it's really important to encourage them to still register their activities on the Antibiotic Guardian website, so that we can know who has taken action. And within the toolkit, we suggest activities you can do. So for primary school, for example, and for secondary school, we have a presentation available, but also you can do a presentation on antibiotic use and hand hygiene, or you can do a games activity, which is where you show the children the impact of not washing their hands adequately, or just show them how bacteria or microorganisms spread. We have the key information for you within the toolkit on how to do that. It can be as simple as you playing the Keep Antibiotics Working video in an assembly and then giving them leaflets to take home. You will need to order those through the campaign resources website. You can also ask the children to share what they've learned through a creative, such as a poster, a song, a jingle, or fridge magnets, and or they can color in a microbe coloring sheet, really just to get the children engaged in the activities rather than being talked to. It will be important to ask them to consider what antibiotic guardian pledge they wish to do, and also to encourage them to tell their parents to choose a pledge as well. For secondary school, we have a large collated slide set, which covers infection. It actually covers microbes, infections, antibiotic resistance. There are interactive workbooks. There's also a game. And again, if that's not possible, you may want to consider just playing the Keep Antibiotics Working video or give them a leaflet, but asking the students to choose a pledge as well. You could facilitate a group debate as your activity, and we include in the toolkit the downloadable versions of the debate kits, which you can print and use on paper. There are also crosswords and quiz that you may wish to use. Again, all within the resources toolkit. I mentioned that there are 2 presentations, and so again, these are in the folder, and really there are a range of sections within those. The primary school presentation is very simple, and it actually focuses more on a cartoon of a child that is ill and what actions they take. So that could be a fun way to engage with children. But all through 3 of them, the themes you'll find are about hand hygiene, infections, use of antibiotics and antibiotic resistance, and particularly in the secondary school one, there's more information about microorganisms. I said earlier that the secondary school care talk presentation is really large, the 76 slides. So really important for you to consider which slides you do not wish to present, depending on how much time you have. And within both presentations, we have some final slides, which talks about the fact that to tackle antimicrobial resistance, everybody has a role. The everybody has a role slide for the primary school is much more engaging than this one, which has a lot of text in it. But also, as pharmacy professionals, we often don't get into schools to promote the profession as part of Careers Day. Some of you may have done that already, but I find that it's more challenging for primary school children or secondary school children to know what pharmacists do. And this gives us an opportunity to share what the role of pharmacy is in tackling AMR, but also for you to share your role as a pharmacist. And so you can see on the middle slide there, the different actions or different roles the pharmacists have. And this may be an opportunity to share this with the children. There are activities, pre and post quizzes that can be used. Again, these are all in the resources toolkit pack, so that it's easy for you to download and print as you wish to. We highlight some hand washing activities. So if you wanted to do a hand washing game, we show you tips from the eBug team whilst they're attempting it live. But also on the Antibiotic Guardian website and NHS website, you can find full hygiene educational video. The primary school video is particularly useful, and honestly, I think if that's all you can do, it's still a great educational tool for the children, because it really takes them through the whole process, the why they need to wash their hands, how to wash their hands, and gives them a whole a well-rounded educational video for children. And for secondary school children, secondary school students and young adults, This 40-second video just really shows the the techniques for washing hands properly. Just quickly to highlight that some of the resources that you want to remember to print and take are crosswords and templates. The pledge templates are available as well. What would be really helpful is if they're collected in and we consider how we can enter them onto the Antibiotic Guardian website or collate that information in another way. And for secondary school, there are activity worksheets as well, and also the before and after quiz. We will need the data from the before and after quiz as part of the evaluation. It's really important, please, the schools have registered. At the moment, we have lower registration from the schools, but it is really important that the schools register. It's important that you note down how many children were in attendance in your session, because that will be asked as part of the feedback. Do consider taking photos, but consider if you could probably perhaps take them from the back of the classroom so that you are inside but not children's faces, or ask the school what the policy is for taking photos. Ask the school about the policy for taking photos. I mentioned earlier the before and after quiz. This is especially important for secondary school. And then determine in advance what activities you want to carry out. If you're going to play video, will that work? And please collect feedback from the students and participants as well. As I said, we will need your support with the evaluation and feedback in order to help determine if we go to a wider pilot or full rollout next year. To assess the toolkit, we are using AppBox, which is very similar to Dropbox, but it's accessible through NHSnet. And within the folder that we will share with you, you will find in there the actual toolkit. So you'll find the toolkit and you'll see that there are two versions there. There's one for internal PHE staff, but there's also a toolkit for pharmacy professionals. You'll find the text for the newsletter, which is this one, which you can forward on to schools, but again, reminding them to register. The pledge sheet is also there, and a poster design template should the children decide to design a poster. The quizzes and crossword folders there, as well as the presentations, the debate kits, and there are additional resources which you may want to consider and have a look into there to see if they are helpful. So we had a range of questions, and I've tried to tackle some of them through my presentation. For example, could the activities be undertaken outside of World Antibiotic Awareness Week? And the answer is yes. And ideally, we want those to be done before the end of November. There are other questions that have come through, but what I've done is to send an email directly to those who were asking the questions. Other questions that we often get is, how do you get resources, or are there stickers available? And yes, stickers are available that you can give to the children once, as part of sending this webinar. A link to register in terms of how many stickers you'll need and where they should be posted to will be provided as well. So this is what the pledge document looks like, that we're encouraging that they sign or that they complete. And we need to consider how we collect that data, because that's going to be important as part of evaluation to see which of the pledges children are choosing or students are choosing, and then and whether or not they think that they may ask their families to also pledge and choose a pledge, or they'll be visiting the eBug website. So that was all I was going to share as part of the webinar. It's a very short webinar to take you through the project. Please do feel free to tweet and to share your experience as you go out into the schools. And just to summarize, the next steps now is to encourage schools to register onto the web page, which is antibioticguardian.com/schools. It's for you to have a look at the toolkit, which is a PDF document, just so you're familiar with what's available. Have a look at the presentations, determine which resources you'll need to print to take with you in terms of the quizzes, for example, but also remembering that whilst you're there to collect key information in terms of how many children were at your session, and also to collect feedback from them as well. We're very, very excited to have more than 60 people signed up overall to become Antibiotic Guardian ambassadors. And we really, really, schools ambassador, and we really, really look forward to getting your feedback on the toolkit, but also the process of accessing schools and sharing with schools. We hope that it gives us an opportunity as pharmacists, I'm a pharmacist myself, as I said earlier, to be able to share the profession and our passion for the profession to the young children and students that we come in contact with. Thank you very much and have a wonderful time through your activities.